what is the most overlooked factor in improving women health in India?
The large number of women who are kind of living with period poverty, even though it's very much doable, and it's all because they are either not aware about the impact that safe menstrual hygiene. I think menstrual hygiene has been a challenge, and it's been a taboo subject, not just among men and boys, but also among women. Women also don't want to discuss. We have had about 17 such women-led units, and this is a group of 5-6 women in rural areas, in peri-urban or slum areas, who have been supported by plan to set up a low-cost sanitary pad unit. They're doing social marketing, they're spreading awareness on menstrual health, and also making money.
How you see organization like yours can do some kind of initiatives? Hello everyone, welcome to IHW podcast, the show where health meets responsibility. So today we have a very special guest with us, Mr. Mohammed Asif, Executive Director from Plan India. Welcome to IHW podcast, sir.
Thank you.
So I would like firstly to give you a view on what is the most overlooked factor in improving women health in India.
Most overlooked factor, it's very difficult to say which is the most, but there are a number of factors which are critical to improving women's health. And just now when we were doing the session, so I was talking about how do we improve health-seeking behavior? Because many times, especially with the way in which we are organized as a society, particularly because of patriarchal norms, women tend to neglect their health. They don't reach out for healthcare support on time. They prefer to just see if they can get well without having had to go to the doctor. And there are other challenges that they face. So health seeking behavior definitely is an important part of it. Because of poverty, women also have to suffer lack of access to healthcare. So it's not just about timeliness, but it's also about access many times. Another important area of health which is neglected is period poverty. The large number of women who are kind of living with period poverty, even though it's very much doable, and it's all because they are either not aware about the impact that safe menstrual hygiene has on their health and wellness. And so these are some of the points which I thought are areas where women's health can definitely be improved significantly.
So I think we see there is a lot of awareness and people are more focused, and now they are speaking about menstruation hygiene and women health specifically. But the time being, if we talk about 10 years prior, so how was your view, and how at that time you guys were preparing for the awareness and reaching out to the rural areas? So
Yeah, I think menstrual hygiene has been a challenge, and it's been a taboo subject, not just among men and boys, but also among women. Women also don't want to discuss, and so there's been a lot of women-led efforts, girls-led effort, where they've tried to break the taboo, and that's been in the last 2 decades. And today there are a large number of girls I have seen in schools, in communities, who are not apologetic about discussing questions around periods and menstrual health, which is great because that's the starting point to that. Other areas which I think important in this space is a large number of women self-help groups are now manufacturing low-cost sanitary napkins. Plan International India chapter, the organization that I represent, we have had about 17 such women-led units. And this is a group of 5-6 women in rural areas, in peri-urban or slum areas, who have been supported by Plan to set up a low-cost sanitary pad unit. they're doing social marketing, they're spreading awareness on menstrual health, and also making money by selling low cost sanitary napkins, so improving on their livelihoods.
Yeah. And sir, is there a myth about women's health program you'd like to debunk?
Mm. See, I think no, I don't know about the myths, but the myth is more something or more to do with patriarchy. Because many times patriarchy tends to, like, let's take the question of menstrual periods, and you still have many families, many women themselves who have been socialized to believe that during the days of the period they need not do certain things. They can't cook and they can't do certain uh, types of things, which is driven more by certain social understanding, cultural practices, which I think women themselves are challenging. Many of these women's groups, girls groups, they are now spreading awareness that periods are normal. Similarly, there are myths related to early and exclusive breastfeeding. I think there are understanding that the breast milk, especially immediately after delivery, is not good and something which needs to be discarded. Whereas doctors insist that no, that's the most important milk for the child and for the newborn child, and it improves their immunity. It provides a lot of other nutrient support that the child needs to grow up healthy. And so that myth is also being challenged, and early exclusive breastfeeding is now becoming a norm, and many women are getting into that. There are other myths around complexion. There are myths around what is beauty, because that's defined by social understanding. And the good news is that girls, women, especially with the advent of social media, they are challenging those notions. They're saying that no, just being fair is not something which is important, not an attribute of beauty. So I think those are some of the things which I wanted to just share through this podcast.
So I think there are so many taboos and there is misbelief and about menstruation or as you have said breastfeeding and all. So how you see organization like yours, Plan India, organization which I represent, IHW Council, and maybe government policymakers can do some kind of initiatives, awareness, which should impact society to come more forward about these topics.
Yeah, I think the things are changing. So it's no, most of these problems are now being tackled. They are being addressed quite often, not just by women and girls, but also by men and boys. They are stepping out. I have met a number of boys who are championing conversations on menstrual health and hygiene, and they are peer educators talking about period poverty, no, eliminating period poverty. Similarly, there are lots of people who are talking about mental well-being, mental health. They're talking about maternal health, so reproductive health, morbidities, challenging that. So a lot of those initiatives are already happening. Specifically, what we can do is continue with pushing the envelope on no, awareness, spreading awareness, no, changing behavior, because behavior change, an area which is still something which more work needs to be done, is vaccination. We have adolescent vaccines which can prevent diseases. One of the biggest challenge that women's health faces is cervical cancer, and there is a vaccine. The government of India has been pushing the uptake of the HPV, which is the vaccine to eliminate cervical cancer in our country, and we can push on spreading awareness and uptake of vaccine, ending vaccine hesitancy, as we did during the COVID period. Also, care and treatment, and timely care and treatment. Another area which I feel important for us to work is self-care. That how do we help working on the pre-preventive, not when you have a problem. When you don't have a problem, how do you improve? And I'm so happy that the government of India is pushing on things like yoga, which is about creating larger questions of wellness and not, but important for improving public health in our country, especially for women and girls.
Yeah. So, sir, or you like to share? I would like to know a story from your side, in which you have worked on any kind of initiative which is very close to your heart and which actually impacted society, maybe women health or something neutral. Also, you can share.
So let's take the question of mental health. While we have worked on various aspects of public health, but no, let me talk about an opportunity that I got because of the Miss Universe organization, and we had Harnas Sandhu. She was the Miss Universe, and so Miss Universe organization reached out to me, saying that Harnas has to do some social work because she is the crowned Miss Universe in that year, and so what is it that how can plan support and her in her endeavors, because she wanted to do something in India for girls and young women. So I proposed maternal health, menstrual health, that if she can take the effort, because her mother is a gynae herself and she is very familiar from childhood about the challenge that women face. And because of that effort, today we have nearly 200,000 women who were in period poverty have now embraced, and they are into menstrual health and wellness, uh, adopting safe menstrual practices. And no, at least as I earlier mentioned, there are 17 groups of women, small groups who have self-help groups or joint liability groups of women who have set up low-cost sanitary napkin manufacturing unit. So what we tried to do was that earlier the impact was thought to be created by first spreading awareness in women, and then trying to break taboos in men and boys, stereotypes, and then creating access to menstrual products. Because that was the process through which transformation was sought to be brought in the menstrual hygiene, health and hygiene space. What we did was we reversed the process. We said let's identify a group of women, support them with a low cost sanitary napkin unit, help them become sanitary entrepreneurs, menstrual pad entrepreneurs, and they will then spread the word, spread awareness, and therefore that was more sustainable transformation. Another important area which I wanted to just talk through your podcast is the work that we have done in preventing parent to child transmission of HIV. In our country, as you are aware, we still have a large number of new cases of HIV that gets reported. As per government statistics, it's about 80,000 every year, and nearly 8 to 10% of the transmission of the HIV virus is from a positive pregnant mother, HIV positive pregnant mother, to the newborn child, which is preventable. So, what Plan did in 2015 was to reach out to the government of India with National AIDS Control Organization, supported by the Global Fund, to see how we can prevent or eliminate the transmission that happens of the HIV virus from the mother to the child, or what we call eliminate mother to child transmission of HIV. Very happy to report that we have been very successful, not just in supporting those children who were born, and there were about 35,000 children who were born to positive pregnant mothers, and who are HIV negative, because what Plan did was to work with the government to ensure that every pregnant mother was aware of her HIV status through HIV screening and testing. And once it was identified or proven that this mother is HIV positive, she was supported through antiretroviral therapy, through other institutional deliveries to ensure that she delivered in an institution, She was taking HIV medicines as prevention, and once the child was born, the child was supported with Neurapin, which is a certain therapy that is prescribed by doctors, and eventually through early infant diagnosis, spreading over the first 18 months of the child's the birth, the child was eventually formally considered as a HIV negative child, even though born to a HIV positive mother and parentage. And that was something which all of us at Plan are very proud that we were able to make our contribution to transforming that in that space. So menstrual hygiene and HIV are two areas which I feel very proud that I have been associated and I have been able to make my modest contribution to transformation there.
So, what's your one take home message for our viewers which you would like to give?
I think the most important message that I would like to give from this platform is how can we help women who are not practicing health seeking behavior to improve on health, access healthcare. It's free, it's in your neighborhood. It's just making that effort to go out there and seek timely medical care assistance so that every woman, every girl, every adolescent girl is able to prevent any reproductive or general morbidity and lead a life of health and wellness.
Thank you so much, sir.